The C-Flex is intended as a universal head positioning system. The C-Flex is oriented with the bumpers toward the head of the frame. The bumpers are to ensure that enough space is left for full adjustment of the C-Flex. Fully tighten the blue knobs on the frame mounts. After tightening the knobs, check that the mounts are fully seated and flush on the frame. The C-Flex can be moved laterally by loosening the upward-facing blue knobs. For a smoother motion, apply light upward pressure while sliding. Hold the upward pressure as you tighten the knobs. The C-Flex is a modular system. The first of 3 included headpieces is the prone face mask, intended for non-rigid procedures. Each headpiece connects to the C-Flex in the same manner. The cone is pressed into the housing until it clicks. Tighten the knob on the side of the housing to remove excess play in the headpiece. Grip the handles to adjust the C-Flex. Squeeze the handles close to the end to get the most leverage. Squeeze both handles firmly to fully release. Experiment with your grip to find the best hand position for you. The C-Flex is now free to move through its full range of motion. Release the handles to lock. After adjusting the C-Flex, always apply light pressure to ensure that it is locked. The C-Flex has a set of adjustable mirrors so that the patient's face can be monitored throughout the procedure. To remove a headpiece, loosen the knob on the side of the housing 2 to 3 turns. Squeeze the tabs under the housing and pull the headpiece straight out. The second included headpiece is the flat plate. The flat plate can be used in multiple types of procedures, depending on what type of cushion is used. For example, a foam block can be used for prone procedures. A gel donut can be used when applying traction. A pillow can be used for anterior procedures. The third included headpiece is the starburst adapter. This connects to a standard skull clamp. Align the starburst pattern on the skull clamp with that on the adapter. Screw the two together until the teeth interlock and there is no play between them. Now you can attach the skull clamp to the C-Flex. For procedures using translaminar screws, position the C-Flex against the stop on the side opposite the surgical site. The starburst adapter can also be connected to a horseshoe. The C-Flex should be covered during procedures to keep contaminants from getting inside. The Clean Cape disposable was specifically designed for this purpose. Fit the blue pockets over the C-Flex handles and drape the cape over the arm. Wrap the cape around the arm and secure it with the first 3 white straps. Wrap the cape over the end of the arm and secure it with the 4th strap. The C-Flex comes with its own storage case. Align the bumpers on the C-Flex with the cups in the storage case. Stretch the C-Flex out along the bottom of the case. Place each of the 3 included headpieces, the prone face mask, the flat plate, and the starburst adapter into the storage case. Slide the top on and the C-Flex is ready to be stored until the next procedure. The prone arm boards support the patient's forearm during a prone or lateral procedure. To set up the prone arm board, first attach the arm board rail to the frame. Next, put the rail clamp onto the arm board rail. Slide the post of the prone arm board into the rail clamp. The height and angle of the prone arm board can be adjusted using the knob on the rail clamp. The orientation of the forearm support is adjusted by the knob on the prone arm board. The prone arm board can be inserted into the rail clamp from the bottom or the top, depending on your preference. The prone arm board can be positioned on the frame in front of the C-prone or behind it, depending on your preference. The prone armboard, rail clamp, and armboard rail can be stored as a single unit to simplify setup and storage. The supine tops turn the frame into a solid surface that can be used for supine procedures. A variable number of supine tops can be used depending on the particular application. 4 supine tops will cover the entire length of the frame. There are cutouts in each supine top where other equipment can be attached to the frame. The armboard rail can be attached for use with standard or prone armboards. The short accessory rail can be attached when tools such as retractors are required. The long accessory rail spans 2 cutouts, allowing for more flexibility in the placement of the tools relative to the patient. Using 2 supine tops and a C-flex enables you to use a Wilson frame with the flex frame. The recommended products for prone lumbar procedures include the wing set system, the C-prone, and the prone armboards. Before transferring the patient, remove the prone armboard on the side of the frame where the stretcher will be placed. Line up the stretcher parallel to the frame. Bring the frame to its lowest height. If the frame is not level, lower the OR table. Raise the stretcher height. The stretcher should be high enough so that it just clears the pins on the side of the frame. Move the stretcher flush against the frame. Lock the stretcher. Adjust the position of the wing sets so that when the patient is transferred, the iliac crests and upper rib cage will be supported. With 4 or more people, roll the patient onto the frame. Readjust the wing sets to contour to the patient's anatomy. Make sure that the bony protrusions at the hips are centered on the hip pads. With male patients, center the nipples on the chest pads. With female patients, push the breast down into the abdominal area or remove the center pad on the chest wing set and push the breast in. Make sure that the abdomen is free from pressure. Adjust the comfort covers so that the patient is not lying on a seam. Roll the patient's hip back and pull on the cover. Hold the cover above the seam so that you are pulling both the foam and Tyvek layer. This will ensure that the cover does not rip. Repeat this for all 4 covers.